Hi, my name is Dr. Manolis Manolakakis, and I am a facial cosmetic and reconstructive surgeon.
If it was easy, everyone would do it. Oh,
Yep.
man, this is not easy.
This is Behind the Beard. You're gonna get squeamish from this? No. Nah.
I've never seen the stomach. Nah, you're alright.
This is easy. The eyes are more squeamish for people than anything.
Really?
Yeah.
I don't know. Some people don't like that.
The little lipo action. Yeah, it's not bad.
I'm ready to go.
Yeah. That is a centrifuge, and that's going to help us get more of a pure cleansed fat. So you'll see a separation of the oils, the local anesthetic that was injected, and the fat. The fat will be nice and creamy and yellow. And then we'll transfer that into another syringe. 3 mLs back. Good. Now you should go back and forth, spokes in the wheel. So we're doing a betadine prep. So this disinfects the skin and makes everything nice and sterile. And once we do that, then we cover up the periphery of the surgical site. So the surgical site is really from the temple to temple and really right up to the upper lip. Not every eyelid surgery or eye rejuvenation surgery is created equally. So some people have really well balanced eyebrows and they're in the proper position, some don't. So my initial evaluation of this patient involved showing that there was a little bit of a lateral brow ptosis, or kind of dropping down of that aspect of the eyebrow. So by performing a lateral brow lift, which is really isolated to the external or the part near the temple, we can provide a lifting effect. Then combine that with the upper blepharoplasty, which helps me keep the same shape of the eyelid because I'm removing less skin, so I'm not hollowing or I'm not skeletonizing the upper eyelid when we use that in combination. So here we're just again putting deep stitches. I want to take some of the tension off of the skin so it leaves a better incision, better scar. We're also making this incision slanted or beveled to the skin surface, which will allow the hair to grow through the scar, which will then better camouflage the incision and scar. We don't look at the eye just as an eyelid or a brow or just one line. We don't do that. We look at it as in the totality of the entire aesthetic component, and that is the brow, it's the temples, it's the amount of skin that needs to be showing after a blepharoplasty. All right. So right now we're doing a little bit of, so we did the upper blepharoplasty with the lateral brow lift part. We already took the fat transfer. All right, so we got that. That's cooking. That got, if you can see right here, it's already starting to be transferred into our little injection syringes. And then we're going to finish up on the upper blepharoplasty and the lateral brow lift on this side, just like we did on the left side. So on the right side, we're going to do the same process. And then the final step is going to be the lower blepharoplasty through a lower eyelid incision. So we're not going to actually make any incisions on the skin, because when you look at this patient, she doesn't really have a lot of eyelid sagginess. She just has a little bit of hollowness in this area, a little bit of hollowness here, and a little bit of fat and protrusion. So we're going to do some camouflaging stuff. That's going to be really, really nice. So our patient is now in the recovery room. They're relaxing, they're awake. They are having ice placed onto their eyes to decrease some of the swelling. She's been given post-operative instructions of what to do, what not to do. Primarily for the first 24, 48 hours, we like to keep her head up, icing, keeping her nice and relaxed and pain-free. Over the next week, she'll have some of the skin incisions removed, especially from the upper eyelid. And then in the temporal area, we'll take them out at about 10 days. Okay. All right, let's go ahead and take off this. You look awesome, by the way.
That's the
That's
stuff you
the,
put in.
yeah, that's a little, yeah. And it's just the swelling from the dissection.
Okay.
But your brows are money. It looks great. Yeah, it looks really good.
You can tell already?
Oh, yeah. And again, you got a little bit of this swelling here. All that stuff is going to go down.
Okay.
Yeah, all that goes down.
Hi, my name is Catherine. I chose to have several procedures done on the same day. It was a facial rejuvenation, also known as a facelift, a neck lift, a brow lift, and a lip lift at Dr. Manolis' suggestion. I admire his honesty and his transparency. I'm familiar with the work that he does on behalf of the underserved population, children, his cleft palate work. And, in my field, that means so much because there are so many people that are deserving of help that don't receive help. And, in terms of his practice, he's always been straight up with me and, tells me like it is. And I just trust him. For me, it's really about trust. It's been 3 months to the day today that I had the surgery. I had my 3-month checkup last week, and I just adore Dr. Manoli and his staff. And we laugh and make jokes about how young I look. And I live in Asbury. I was driving through town and I saw him and honked and waved, and he didn't recognize me.
So Catherine is a very interesting person. She does a lot of volunteer work abroad in other countries. She also did a lot of work in the fashion industry back in the day prior to doing a lot of volunteer work. So she's a very, very well and exceptionally traveled person. So she knows about cosmetic surgery. She has a lot of friends who's had it, and she had a fantastic result. She ended up having a lower facelift and a brow lift, and I can't talk about how great the procedure went and how well she did post-operatively, and she looks fantastic.
He's just a really good person, and I would recommend him, and I have recommended him to a lot of my friends who are my age, because they can't believe the way I look. They saw me 3 months ago or a year ago, and a lot of the people that I know are in a position to be able to have, some sort of surgery, and they're looking for people that they know in their world that feel comfortable.
You gotta make them feel what your passion is about it, and that's what lecturing is all about. You got to basically open up who you are so that crowd, that the people in the audience listening to you aren't just listening to, I make an incision like this, I retract like this, I stitch like this. That's boring. The first year resident can tell you how to do that. They can look in a book and they can read off the list. If you go up there and say, I don't get complications, then you're not doing enough surgery.
There you go.
The more surgery you do, the more issues you're going to have. All right? It's just it's the nature of the beast. About 3 years ago, I lost my nephew. So it first started out with the Greek letters on the inside saying, I'll meet you in heaven. That's how it translates. This is Behind the Beard.